Anesthesia is the use of medications to render a patient unconscious, which enables invasive surgical procedures.
Before this, you could think of, like, say, Civil War times was around the time when they invented anesthesia. They would get you drunk, so it could give you ethanol, and then they would just start a surgery, and you would be awake, and the pain itself is what would put you to sleep. And then you'd wake up after the surgery's done, if you were lucky, and then that was what anesthesia was. It was actually the pain putting you to sleep.
The introduction of anesthesia in the clinic completely transformed modern medicine. Being able to have an intense, invasive procedure, then you no longer encode any memory about this event. You don't remember the trauma. Overall, it probably minimized human suffering by a dramatic amount, probably more than any medical invention that I can think of.
Anesthesia is safe if you have an anesthesiologist. This is a person that is very well paid and highly trained, and you want them to be there with you for the surgery. And their job is to keep you alive while they give you these drugs. And there aren't many drugs like that.
We have a project ongoing now where we're trying to develop anesthetics that are safe enough to be used outside of an operatory. So where you don't have to have a highly trained anesthesiologist in order to administer the medication. The operative term now is safety. That's entirely what we're motivated by. We're uncovering things all the time, things that are constantly surprising us. We've been using a technological platform in which we test potential anesthetics with fish. We can look and assess the loss of consciousness in fish, and that really has accelerated our discovery. Historically, when you're looking for anesthetics, you would test compounds in mice. And as you might imagine, mice move around a lot and they're doing all sorts of things, and it just would be impossible to test literally thousands of compounds in mice. But using fish, we can test compounds in a much, much faster way. So we are now in the process, my teammates and I are completing a 100,000 compound screen. We've tested over 100,000 compounds looking for those that have anesthetic activity. And we have discovered a few dozen compounds that look like they might have promise. But our goal then is to try to take those structures that have come out of this testing of random compounds. We want to sort of optimize them and make them into molecules to have more of a medicinal profile in terms of the structure and pharmacology.
The last anesthetic that was widely used, it's highly insoluble, it's not potent, so that means you need a lot of it for it to work. There's a term, we call it the therapeutic index, which means the dose that kills you and the dose that works, they're really close to each other. Our molecules have a higher therapeutic index, meaning that they're safer. So the dose that works versus the dose that kills you is much higher. Surgery itself is going to be much safer now.
The other thing, we've been working quite closely with the Department of Defense to try to develop anesthetics that can be used in the battlefield. So we've been the recipient of a $25 million grant in order to develop safer anesthetics that could be used by soldiers in the theater of war.
If we can take an injured soldier and make sure that they come home, that's an enormous thing. Because right now what we have a situation is the battlefield is changing. As we can see, it's complex. If it takes days to get a soldier off the battlefield, that means that their likelihood of survival is less. So if we can come up with an anesthetic that's safe and stable and long-lasting, then that means that soldier can come home, and that's a big deal. There are so many situations where we don't need an anesthesiologist. So right now we have a backlog of something simple like colonoscopies. And it's so hard to field anesthesiologists, these fully trained, highly paid people, which there's a shortage of. Everyone who wants a colonoscopy can't get one. But imagine now that you could have a highly trained nurse be able to give you an anesthetic, a very light anesthetic, and now you can do these minor procedures without the need for someone who just takes so much training. There's so few of them. These safe anesthetics are really going to change people's access to care.
This is probably one of the most exciting projects of my career so far. We're only 2 years in of a 5-year project, so I think a lot more ground to cover, and we're already off to a great start, so just looking forward to seeing where this takes us.
I don't know what I've worked on that I've been this excited about, where I sort of see the transition from research laboratory into patients. So I'm excited about this.